Hello and welcome to my YouTube video. Today I'm going to talk about the healthcare bills in the House and Senate. This is a topic that a lot of Americans are concerned about, and rightfully so. Tens of millions of Americans don't have insurance, and yet we spend more per person in this country on healthcare than any other nation on earth. So we clearly have a problem. Unfortunately, the bills in Congress are not a good answer. Both bills are fundamentally flawed. First, it shouldn't take 1,000 pages to create reforms that will really help Americans. And secondly, why should we have to pay another $1 trillion? We already spend way more money on healthcare, not insurance, but healthcare, than any other country on the planet. Even with tens of millions of Americans not having health insurance, we still spend more per person on healthcare in this country than any other nation. And not just a little more, we spend a lot more. Look at these 2009 numbers from OECD. The United States spent more than $7,000 per person on health care. Again, remember, this is the average across all people in the U.S., including the uninsured. The next closest country is Norway, at less than $5,000 per person. France spent less than half as much as we did. So did Belgium, Germany, Denmark, Ireland, Australia, Sweden, Iceland, the United Kingdom, not to mention the rest of the world. So if we're spending this much money on healthcare in this country, obviously there's enough money in the system already. We don't need to spend another $1 trillion. What we mainly need to figure out is how to use all those dollars more appropriately. So, do we need a healthcare bill? Yes, we do. And I'd like to believe that the people writing these bills really think they're acting in Americans' best interest. Unfortunately, while these proposals are well-intentioned, they're short-sighted. They would actually make health insurance more expensive for the vast majority of Americans, not less. When you hear about some of these proposals, they sound like they would help consumers, but you have to think about the consequences and what they really mean. Let's start with one of the easiest, guaranteed issue. This sounds like a good one, but it's a recipe for disaster. Guaranteed issue means that you can't be denied if you apply for health insurance. No matter what health problems you have, every insurance company has to take you. Now don't get me wrong, there are millions of Americans who can't get insurance today and they need help, but some states have come up with a much better solution, called high-risk pools. I'll come back to these in a minute. Well, let's talk about what's wrong with guaranteed issue. Guaranteed issue means that people could wait until they get sick before they buy health insurance. Just imagine if homeowners insurance worked like this. If we followed the same approach for homeowners insurance, you could wait until your house burned down before you bought it. Just imagine. You could call up the insurance agent and say, "Bob, I'd like to buy insurance from you. My house is burning down. How much will it cost?" Well, in a world like that, where everybody could wait until their house burned down to buy insurance, homeowners coverage would have to cost at least as much as buying a new house. The only way insurance works is if you have low-cost people who subsidize the expenses of the high-cost people. If my house doesn't burn down this year and we don't get hit by hail or a tornado, then I'm one of the low-cost people. Less fortunate people had a rough year and their house did burn down, or they were hit by a tornado. The insurance company was able to pay for a new house because they had the premiums from all the more fortunate people that year to pay those costs. This is how insurance works. Now, some of you are probably already objecting, but what about mandated coverage? If everyone has to buy insurance, then there's no problem with guaranteed issue. Well, the problem is the mandate is just too weak. One of the bills says individuals would pay about a $75 fine if they don't have coverage. Now you tell me, how many perfectly healthy 25-year-old males with entry-level jobs, for instance, are going to pay, say, $2,000 per year or more for health insurance when they can just pay the $75 fine? Both the House and Senate bills would raise rates for the youngest and healthiest people. Why? Because they're trying to make rates more affordable for the oldest and sickest people. But unfortunately, this is another example of being well-intentioned but short-sighted. Now, when we talk about most of these changes, we're talking about the individual insurance market. This is for people who don't get coverage through an employer. but instead buy directly from the insurance company. You can buy individual coverage for a single person, for a couple, or for a family. Individual insurance simply means you're not buying your insurance through an employer or association group. When you buy individual insurance, your monthly rate is based on a few factors such as your deductible level, your co-payments, etc. But in many states, your rate is largely based on your age and how healthy you were when you signed up for insurance. Here's a chart of hypothetical monthly rates in a state that allows insurers to charge the oldest members no more than 5 times as much as they do the youngest members who have similar health. This may seem unfair to a lot of people until you understand how this really works. In several states, insurers are allowed to charge 35% less than their standard rates for the healthiest members and 35% more for the least healthy members. Now again, critics like to accuse insurers of gouging the sick or trying to run them off through these rating methodologies. But the reality is, this system actually helps keep rates lower. Okay, now you might be saying, yeah, right, or how do you know? Well, this topic was near and dear to my heart several years ago when I was finishing up my credentials as an actuary. I'm a fellow of the Society of Actuaries, or FSA for short, and a member of the American Academy of Actuaries. To get my FSA, I had to complete a professional development project on the subject of my choosing. So I looked into how actuaries can help keep individual health rates affordable. There's a whole paper by an actuary named Bill Bloom on this subject. It's called Cumulative Anti-Selection Theory. Now, that's a really fancy term, so I'll break down the basic ideas. Bill Bloom knew exactly what I've been telling you from the beginning of this presentation, that the healthy people make insurance affordable for the sicker people. If you don't have healthy people in your population, then the sick will have to pay for themselves. Now, healthy people realize that they're going to pay more for insurance in a good year than they would have without it. But they can live with that, as long as the rates aren't too unreasonable, if they know that they have coverage that will take care of them when they do get sick. So just imagine what happens if you don't allow insurers to give better rates to the healthiest members, and they have to pay the same rate as everyone else. All these people paying lower rates today, the ones shown on the green line, they would see their rates jump up to the blue line. Some of our elected officials think that's a good thing. They say, great, we'll have more dollars to pay for all the sick people. But that's not exactly how it works. Healthy people buy insurance because they think it might be a deal for them one day. Right now, they're losing money on the deal. They're paying more out for health insurance than they would for their cost out of pocket if they didn't have insurance. But they know a year could come along when they need an expensive surgery or get sick. But there's a limit to how much you can charge these individuals before they give up and go. When they do, you're left with nothing but the not so healthy and the very sick. These individuals were already paying higher rates, but what happens to their rates when the healthy people leave? They have to go up. Those healthy people, many of them only see the doctor once a year, if that. Maybe they get a single cheap medicine from Walmart for $5 for an antibiotic. Those guys, those are all gone, and all their premiums go with them. So nobody's around to subsidize the cost of these remaining unhealthy individuals. So now, all of these less healthy people have to pay their own cost, which means rates just go up and up for everybody. Then what are you left with? Rates that nobody can afford. A situation where healthy people would like to get insurance, but it's far too expensive to be worthwhile, and the sick can't afford it, but they also can't afford to be without it. We've seen this happen over and over. Politicians, with the best of intentions, enact reforms, hoping to help the people they represent, but they actually just make things worse. I've seen this over and over in my work as an actuary.